Hello, my name is Dorothy Fox, and I'm the Executive Director and CEO of the Partnership for a Healthier Carroll County. The partnership was formed in 1998 as a collaborative effort of Carroll Hospital and the Carroll County Health Department. As we celebrate our 23rd year, both of our founding members remain our partners today. The Community Health Needs Assessment is just one of the many projects that all three organizations work together to complete. I'll be sharing with you some of the highlights of those results, as well as the areas that have been prioritized and how you can become involved. The assessment is required every 3 years as part of the Affordable Care Act. However, in Carroll County, we have far exceeded those requirements. Furthermore, it is a genuine attempt to hear and understand the health needs of our community. Those involved consider them very fortunate to do this work in our community. The results help inform us in many ways, including where we need to allocate resources and how to plan for future needs. Community feedback alerts us to changes in trending patterns and allows us to work proactively to address noted health concerns. And last but not least, it is the opportunity to educate ourselves and the community regarding health behaviors, conditions, and social determinants. We collect both primary and secondary data. Of the primary data, we have three main components: an online survey, focus groups, and key informant interviews. The online survey consists of 104 smart logic questions, only asking questions that were applicable to one's age, gender, or specific diagnosis. On average, the survey took approximately 15 minutes to complete. The focus groups and the key informants were asked the same questions, which was then followed by a moderated session using specific results of that session. For the secondary data, we used county demographics and other trusted national studies. The online survey was designed to assess health status, health risk behaviors, preventative health practices, and healthcare access, primarily related to chronic disease and injury. A total of 744 resident surveys were collected from throughout the county. The participants were asked questions regarding their health needs and those of their family. To fairly represent those we could not capture in the online survey, we conducted focus groups. This year we held more focus groups than any previous years. Our focus groups included 2 groups with the African American Black community, individuals that utilize behavioral health services, and older adults, as well as a focus group with the Hispanic Latino, LGBTQ+, low income, and transitional aged youth individuals. We asked our focus groups to speak on behalf of their identified community in answering questions regarding health issues and social determinants. Our key informants represented a variety of sectors. 2 sessions included community leaders and stakeholders with expert knowledge in their respective fields, and 1 session that was held with mid-level direct service providers. Our key informants were asked to speak on behalf of their professional experience and the individuals that they serve. This slide is an example of how we collect the information and identify changes in trending patterns. This question asks, during the past 30 days, for about how many days did poor physical or mental health keep you from doing your usual activities, such as self-care, work, or recreation? From 2018 to 2021, there is a reversal of the trending pattern and a decrease in respondents that experienced no days of poor physical and mental health, as well as a reversal of the trending pattern and an increase in the 3 to 7 days of poor physical or mental health. We also saw a smaller increase in each number of days category from the 2018 data. This is alerting us that there has been a significant negative trend in the area of poor physical and mental health days, and that we need to take notice and address. When asked about chronic conditions, we saw 4 diagnoses, disease, and illnesses that stood out: arthritis type diagnosis, asthma, skin cancer, and all other types of cancer. Cancer was a health area that elicited many emotional testimonies. Of those who received treatment at the Carroll Cancer Center, the experience was favorably viewed. However, the other comments regarding the disease itself were not positive. There's a frustration over not being able to cure this disease in many cases. Comments such as, we can send someone to the moon, but we can't cure cancer, were made. Discussions included how many lives cancer touches and how it was impacted someone you know, how difficult treatment is, and how it makes you very sick, the many different types of cancer to be educated about and screened for, the hereditary nature of cancer, which also predisposes someone to the disease, and how the cost of treatment is prohibitive or how it can cause financial ruin. Diabetes was another topic frequently discussed. This chart shows the steady increase in individuals diagnosed with prediabetes or borderline diabetes since 2012. There is an understanding of the many ways that diabetes can harm your health. This is another area that highlighted heredity and even more clearly cultural differences in food choices, food prep, and the significance and the role of the family mealtime. A very interesting fact that we learned was the cross relationship between dental health and diabetes, as poor dental health creates a barrier to healthy eating. When asked if you have ever been told by a health professional if you had high blood pressure, we saw little change. Unfortunately, the follow-up question asked what actions are being taken to control high blood pressure. And we saw a decrease in all 4 categories: taking medicine, changing eating habits, cutting down on salt, and exercising. This is a clear indicator to us that we could benefit from implementing education about the actions that can be taken to manage high blood pressure. As for cholesterol responses, the most significant change to frequency of having blood cholesterol level screening is in the decrease to those who have never had it checked. This is very promising as the results are important to heart health. The next area I'll discuss is related to illegal substance use and substance abuse. This will include alcohol, prescription drugs, marijuana, and other street drugs. First, I'll discuss alcohol abuse. This was a highly charged area for discussion in many of our groups. There was frustration that the addiction and dependency, the severity of the addiction, and the dangers of withdrawal are sometimes lost in the messaging and commercialization. Other discussion points included the potential relationship of in-home alcohol abuse with domestic violence and child abuse, the availability of liquor stores in every shopping center, and the recent message of being essential during the pandemic. The most common thread was accessibility, acceptability, and availability. Now sharing the opioids-related results, 99.5% of survey respondents indicated that they have not used opioids that were not prescribed to them. This percentage decreases to 94.5% when asked if a friend or family member used unprescribed opioids, resulting in 5.5% of family and friends that have used unprescribed opioids in the last 3 months. New questions added this year included those related to marijuana usage. 93.5% of surveyed individuals self-reported no use of marijuana in the last 3 months. Of those who did use, only 31% had a medical marijuana card. As for illegal substance use, very honest and candid discussions took place. The general public seems well informed about illegal drug use and the collateral impact that substance abuse has on our community. It was reported that it's easy to obtain these substances, knowing someone who will sell and/or just being easy to buy on the street. A comment shared that it was part of a lifestyle and culturally accepted. There were concerns shared over the lack of deterrence or repercussions, which has increased availability. We even heard that selling drugs can be a lucrative business and a way to make money. Moving on to the health area of mental health. In a previous slide, we saw an increase in poor physical and mental health days. New this year, we asked follow-up questions related to mental health. When we asked participants to select any of the following that you have felt in the past year, the results were as follows. We can see here that almost 30% of respondents have felt nervous, followed by 21% feeling restless or fidgety, and 18% feeling like everything was an effort. A new question added this year was developed to gain information on the personal impact COVID-19 had on individuals and families. The largest percent of respondents, at 25%, said that the biggest impact was worry about their health and the health of loved ones, followed closely with 24% feeling increased stress and anxiety, and feeling depressed was reported by over 12% of respondents. Unfortunately, we did see that 12% of respondents had missed medical appointments, but we were happy to see that 14% participated in telehealth. We gathered a considerable amount of information related to mental health. Robust conversations took place. Some of the discussion highlights included that we do know that untreated conditions tend to cause neglect of health and wellness habits, which leads to somatic health conditions, that mental health consists of several diagnoses and treatment courses, and the seriousness may not be fully understood by the general population. A lack of providers that treat mental health is an obstacle to receiving care, and cultural sensitivity and understanding is yet another barrier. There can also be difficulties in medication management and compliance due to polypharmacy, and misrepresentation of mental health in the media, as well as associated stigma, lead to isolation and harm. In summary, mental health can greatly impact someone's quality of life. Being able to choose more than one answer, we asked our respondents, where do you go to get your health information and education? We were pleased to see that 68.8% received their information from their physician or healthcare provider. It was followed closely by online websites with 61.4% of respondents reporting. When asked directly how they would like to receive their information from their physician, there were multiple responses. Some wanted to receive it verbally, while others preferred to leave with written documentation. Many wanted a document so that they could share the information, follow up, and directives with family and friends. Another important comment made regarding health information was the ability or inability to distinguish reliable information. Social determinants are the economic and social conditions that influence individual and group differences in health status. From a list of 9 social determinants, we asked our participant to name the top 3 that they believe were the most important to address. Affordable housing, employment opportunities, quality health access, and social support were the selections chosen with the most frequency. Using the highly articulated and repeated themes that occurred during the assessment, as well as our secondary data, we prioritized the top health areas based on the criteria of significance, pervasiveness, and the ability to impact. For significance, pervasiveness, we asked ourselves, how significant is the consequence if we do not address this issue? How pervasive is the scope of this issue? Does it affect the majority of our population or only a small fraction? Is it getting worse, or is there a negative trend? As for ability to impact, we asked, can we make a meaningful difference with this issue? What is our ability to truly make an impact? Are there known or proven interventions with this issue? The results prioritize the following top health areas: mental health, diabetes, cancer, heart health, and obesity. Obesity efforts that are interrelated with the key issues of diabetes, cancer, and heart health will be a main concentration. During the fiscal years of 2022 to 2024, Carroll Hospital, the partnership, the Carroll County Health Department, and other partners will focus internal and external strategies on these health areas. The Community Benefit and Health Improvement Plan includes strategies, anticipated outcomes, and measurable goals for the prioritized health areas. The same key issues will simultaneously be addressed collaboratively with other partners under the leadership of the partnership and the experts that participate on our leadership teams. We have 3 leadership teams: Access to Health, which also simultaneously serves as the local health improvement coalition, Healthy Aging, and Advancing Health and Wellness. Each leadership team is unique in their own way, addressing the prioritizations, but collaboratively working toward the goal of the community health plan. Our local health improvement coalition is striving to gather community input for the local health improvement plan, especially reaching out to those community members who may want to participate but are unable to during normal daytime hours, have transportation, or any other barriers. A community health planning meeting is being scheduled with an exciting hybrid model to afford the greatest access. The date, time, and format is to be announced soon. For more information, you can contact Maggie Coons, the health planner, at the Carroll County Health Department by email or phone. Thank you for joining me and allowing me to share with you the Community Health Needs Assessment results, prioritization, and planning information with you. If you are interested in receiving the full report or an executive summary, or having an interest in joining one of our leadership teams, please reach out to us at the partnership on our website, healthycarroll.org. I wish you a healthy day.